Hello and welcome. Today we're diving into a complex and often overlooked condition, trauma to the auditory nerve. This delicate nerve is crucial for hearing, transmitting sound information from the inner ear to the brain. When it's damaged, the consequences can be significant. We'll explore the causes, effects, and potential treatments for this challenging condition. So what exactly causes trauma to the auditory nerve? The most common culprits include head injuries, particularly those involving skull fractures near the ear. Loud noise exposure, especially sudden, intense blasts like explosions or gunfire, can also damage the nerve. Certain medications, known as ototoxic drugs, can have a toxic effect on the auditory nerve as well. Less frequently, surgical complications during ear or brain surgery, viral infections, and underlying medical conditions can contribute to nerve damage. Let's delve into the pathophysiology, or how this damage actually unfolds. Trauma can disrupt the delicate structure of the auditory nerve in several ways. This includes physical tearing or compression of the nerve fibers, bleeding within the nerve sheath, or damage to the specialized hair cells in the inner ear that communicate with the nerve. This disruption interrupts or distorts the electrical signals that carry sound information to the brain. Consequently, the brain receives incomplete or inaccurate information, leading to hearing loss or other auditory disturbances. Understanding the epidemiology, or how common this condition is surprisingly difficult. Exact figures are hard to come by because auditory nerve trauma often goes undiagnosed or is misdiagnosed as other forms of hearing loss. However, we know that individuals in high-risk professions, such as military personnel, construction workers, and musicians, are more likely to experience noise-induced auditory nerve damage. Similarly, those who have suffered head injuries are at a higher risk of developing auditory nerve-related hearing loss. The signs and symptoms of auditory nerve trauma can vary depending on the severity and location of the damage. The most common symptom is hearing loss, which can range from mild to profound and may affect one or both ears. Tinnitus, or ringing in the ears, is another frequent complaint. Some individuals may experience hyperacusis, an increased sensitivity to everyday sounds, making them uncomfortably loud. Dizziness or vertigo, a sensation of spinning, can also occur if the trauma affects the vestibular system, which is closely connected to the auditory nerve. In some cases, balance problems may be present. Diagnosing auditory nerve trauma requires a comprehensive audiological evaluation. This typically includes a pure tone audiogram, which measures hearing thresholds at different frequencies. Speech audiometry assesses the ability to understand spoken words. Specialized tests, such as auditory brainstem response testing (ABR), can directly evaluate the function of the auditory nerve. Imaging studies, like MRI or CT scans, may be used to rule out other causes of hearing loss or to visualize any structural damage to the nerve. While there isn't a formal classification system for auditory nerve trauma like some other diseases, we can broadly categorize it based on the cause, such as noise-induced, traumatic, or drug-induced. We can also describe it based on the location of the damage, whether it's primarily affecting the cochlear portion responsible for hearing, the vestibular portion responsible for balance, or both. Finally, the severity of hearing loss, ranging from mild to profound, provides another way to characterize the condition. Treatment and management of auditory nerve trauma depend on the cause and severity of the damage. In some cases, particularly if the trauma is recent, medications like corticosteroids may be prescribed to reduce inflammation and potentially improve nerve function. Hearing aids can be helpful for individuals with hearing loss. Cochlear implants, which bypass the damaged auditory nerve to directly stimulate the brain, may be an option for those with severe to profound hearing loss. Vestibular rehabilitation therapy can help individuals with balance problems to regain their stability. Counseling and support groups can provide emotional support and coping strategies. Prevention is key when it comes to auditory nerve trauma. Protecting your ears from loud noise exposure is paramount. This means wearing earplugs or earmuffs in noisy environments, such as concerts or construction sites. Avoiding ototoxic drugs whenever possible is also important. When these medications are necessary, close monitoring for hearing changes is crucial. Practicing safe driving and workplace habits can help prevent head injuries that could lead to auditory nerve damage. The prognosis for auditory nerve trauma varies significantly. In some cases, particularly if the damage is mild or treated promptly, some recovery of hearing may be possible. However, in many cases, hearing loss is permanent. Ongoing research is exploring new strategies for nerve regeneration and restoration of hearing. Advances in gene therapy and stem cell research hold promise for future treatments. Staying informed about these advancements can empower individuals to make informed decisions about their care and participate in clinical trials when appropriate.